Cosmos Limited is a limited liability corporate entity. It is ranked as one of the best manufacturing facility in East and Central Africa with a mission to manufacture and market quality, cost-effective medication for the people of Africa. It is situated at Rangwe Road, off Lungalunga Road Industrial Area, Nairobi, Kenya. Cosmos manufacturing facility is approved by the National Drug Authority under the Ministry of Health. It was established 30 years ago with the aim of becoming the market leader in the development and production of essential drugs for domestic and regional markets, to lead the pharmaceutical industry in the provision of medications for prevention and treatment of malaria in line with national policies, to work with both national and multilateral agencies in provision of tuberculosis statistics in line with national policies, to play an active role in fighting the HIV/AIDS pandemic by providing quality ARVs and drugs to manage and treat opportunistic infections, to develop and produce products to treat metabolic and cardiovascular diseases. Cosmos Limited was founded by Dr. Prakash Patel in 1977 through 1978 at Busia Road Industrial Area, Nairobi, Kenya. It is the first registered manufacturing pharmaceutical in Kenya. His vision was to leave behind legacy incorporating self-sufficiency in the provision of pharmaceutical products as a component of the healthcare system. As a pharmacist, his career has covered the retail, wholesale and manufacturing of pharmaceutical products. Mr. Prakash K. Patel is the chairman and managing director of the company. He has decades of experience in the pharmaceutical industry.
I'm Prakash K. Patel, recognized pharmacist, registered pharmacist in Kenya, also in United Kingdom and India. In 1985, I decided that I want to manufacture all essential drugs in Kenya. Before that, all of them were imported, and now most of them are manufactured in Kenya, which includes all anti-ARV, anti-TB and malaria. 1985, at the age of 56, I still wanted to make Kenya and this region self-sufficient in medicines. Before that, all of them were imported. I do feel that we have achieved that. Kenya is self-sufficient in most of the essential drugs. That is, more than 80% of the diseases can be treated by locally manufactured.
Cosmos is managed by a board of executive directors who between them have over decades of relevant professional experience in management. Their focus is on all the strategic functional areas of marketing, finance and administration, production and quality control. Cosmos has a number of professional staff from managerial to technical skill. The staff are well motivated, committed and believe in teamwork. They are well equipped with formulation development and analytical facilities to adapt dynamic changes in the pharmaceutical industry.
What we do in Cosmos here is basically we're in the business of making quality, efficacious medicines. And one of the things that we need to do for this is bring technology into product development, process development, and operations. And the ways we do it is we try and look at the modern technologies which are available in the world in terms of IT, process, the new technologies that are involved in drug developments, the machinery. In order to do this, we need to be abreast with the latest literatures of readings, what is available in the world, and we try and apply it to the best of what we can in the environment we are in Africa. And we have been doing that by starting with product development section where we try and develop new products, new ways of releasing medicines into the body, and then we scale up to the production facilities. The production facilities consist of a number of things. We got people, we got machinery, and we got the environment in which we work with. So I'll start with one after the other. One is that the people, we completely train our people on a regular basis with the new technologies and new processes and keep them in terms with the new GMP rules and regulations which are required to manufacture medicines. We bring in new technologies in terms of processes. That means machineries where there's automation involved. And we look at the environment as well, which is the type of air we have in the production facilities. We need a certain class of air to manufacture here, and we bring in new technologies based on that. We have a number of people under my arm where they're all qualified personnel who have worked in the pharmaceutical industry, and my job entails looking after the processes and developing new products and looking at new technologies that are available in the world. And to do this, we need to be abreast with the new information that is available. One of the other things that I'm involved is trying to look at new dosage forms that apply to our local populations here. In terms of products, we look at what are the products that affect the local population in Kenya and in Africa, such as malaria, TB, and antiretrovirals. And we look at the way people take it compared to the Western world. And we try and develop products for ease of the local people using it. One of the simple things is we try and develop, instead of making products which are antibiotic dry syrups where you put water in it, we're making dispersible tablets. As you know, that water is very difficult to get hold of in rural areas, and we don't have fridges there. So the dispersible tablets are the best means of things. So we look at these new ways of innovating our products and differentiating Cosmos from other manufacturers.
Their performance are backed up with 1,508 manufacturing areas, sophisticated and latest manufacturing equipment, extensive library, good supporting utilities like ROCDI purified water system, oil and water-free compressed air system, laboratory management system, LIMS. products undergo production process in a manufacturing facility constructed and developed in cooperation with all requirements of GMP. The production facility comprises of focusing on new product development and continual improvement of existing products and processes. This facility is equipped with small-scale manufacturing equipment for all dosage forms except parenterals. Responsible for analytical method development and stability studies. Responsible for sampling, analysis, release or rejection of starting materials, packaging materials, bulk products, and finished products. This facility is equipped with HPLC system, UV spectrometer, digital polarimeter, photofluorometer, KF titrator, etc. Purified water generation system comprising of ROCDI of 3,000 liters per hour capacity circulated in a distribution loop to production areas user points. Ventilation system for all production blocks. Oil and moisture-free compressed air system. Manufacturing facility equipped with required equipment to process various dosage forms, designed for ease of cleanability, non-reactivity, non-additivity, and non-absorptivity.
Cosmos, we believe in quality, and as locally manufactured, medicines are only important when they are available, when they are required. And that is why it has to be locally produced, because diseases one cannot predict when they would be coming, and if the medicines are not available, you cannot treat. We can say that most of the primary health care, essential drugs, can be also manufactured locally and very effectively. So today, most of the NGOs who treat the patients are buying locally.
During production process, the raw materials are received after inspection and stored in the restricted warehouse. Random samples are taken and sent for analysis to the QC department. The product to be prepared is planned as per statutory reference books, and then the production plan is finalized. The raw materials are then issued in the appropriate quantities for the various in-process like mixing, blending and granulating. The process continues to the punching stage where the granules are punched into tablets. Finally, the tablets are dusted and polished. The samples are again sent to QC to be assayed. Cosmos believes that the ultimate customers are those unfortunate members of our population who have been afflicted by ill health or diseases. It is through the distribution intermediaries in both the private and public sectors that the product reach their consumers. The public sector include the Ministry of Health Kenya, Uganda and Tanzania, city and urban municipalities, while private sector focuses on general physicians, pharmacies, non-governmental organizations, private hospitals, and supermarkets. Cosmos believes in service to humanity. It provides direct services to the public at their subsidized clinic for the needy. It provides food for the employees and has participated in several community medical services.